Good afternoon from Vienna. We're here at the ICS meeting. My name is Paula Igualada Martinez. I'm a pelvic health physiotherapist and the new incoming chair for the physiotherapy committee. I have here with me Angie. How are you, Angie?
I am very well, thank you very much. I'm Angie Rantel. I'm a urogynecology nurse from the UK and one of the members of the nursing committee.
So, okay, Angie, how are you getting on with the conference? What have you enjoyed so far?
It's been great so far. I think the biggest thing that everybody's finding is it's actually nice seeing people face to face and having that networking. You know, it's been great with things online that you can get some science and education, but it doesn't take away from being able to have a coffee with someone and a catch up on a personal level.
Yeah.
And the networking that you do is just so much
Absolutely.
better. You know, from a science perspective, there's been some great sessions so far. There was the session on conservative management and innovations in products that had some really great new concepts of things that's coming out. And again, the conservative management, some great work around education for other healthcare professionals, so midwives, support workers in the community, trying to develop promotion and education about continence around other healthcare professionals. So that was been really good.
Fantastic.
What about you?
I think so far, as you, Angie, I think there is being face to face and seeing everyone has been an amazing opportunity. I think I have enjoyed the Physio Forum quite a lot. I think we have very good interactive sessions. We had a bit of everything: male dysfunction, bowel dysfunction. We have the updates from Chantal about the ICI. And also this morning, we had one of the hands-on workshops, and unfortunately we have to rush off, but when we have the time to practice on, and everyone was so grateful that that opportunity to practice with the irrigation systems and talk about fecal incontinence before they come back to clinic. So I think that has been a highlight. That's
the thing you just can't get with the online. You miss that. There's nothing like actually sitting around a table with the equipment, having a play with things, figuring out and having people talk you through the tips and tricks in person as they're watching you doing it. You just can't do that online, so it's great for those hands-on workshops.
Absolutely, and you did a beautiful review this morning about bladder care during antenatal and postnatal time, and actually this is one of the hot topics at the moment in terms of prevention and management of pelvic floor symptoms. So, it goes in line with some of the conservative sessions, right?
Absolutely, yeah. It was an absolute pleasure to do the IUGA spot today and actually promote that antenatal and postnatal bladder management. So really great to do that, and hopefully there'll be more around that, really, for the sort of multidisciplinary approach to this, and bringing in other disciplines, bringing in the midwives, the support workers, the general nurses. Actually, there's so many more people involved in continence care that we need to get the education out to as well.
What are you looking for
for
the remaining of the conference?
So for the remaining conference, there's going to be some good sessions tomorrow, again on conservative management. And so I'm very proud to be chairing one of those sessions and having read the abstract so far. So I'm looking forward, and I know that you're chairing one of the sessions for conservative management.
I'm chairing one of the sessions as well, and there's one, for example, in terms of vaginal examinations in the UK. How do we get that standard examination across, for example? And also we have the roundtables tomorrow, and then one of the roundtables is about the advanced clinical practice in allied health professionals. So it's going to be quite a good one too.
So for the nurses, the midwives, the physiotherapists, the allied health professionals, the scientists, what do you think they can look forward to in future meetings as well? Do you think there's going to be more for them? You're the chair of the physio committee. What's to come next year for them?
Ooh, okay. So I think, for example, there are 453 physios actually, which is more or less the same amount as urogynecologists. Yes. So there is quite a lot of us. So I was quite surprised. I didn't know about that updated number. So I think for me personally, as a new chair, I would like to sort of bring on more of the hands-on, practical sessions as well. I do remember having them in the past, because again, I think physios, and we were talking this morning how physios, we are very touchy-feely, and then we like to practice things on. So I think if I have to think about the future, obviously this will be a decision with the physiotherapy committee. But again, it's touching in all the areas that physiotherapy works. So is it bowels? Is it men? Is it male dysfunction, female dysfunction? Then we have the postpartum, you know, and postpartum I think is a big thing, right? What do you think?
I think definitely there's going to be a slight change in track, but I think there's just going to continue to be more and more for the non-medics coming through and more relevant to their day-to-day practice.
Absolutely.
So, Fab.
Thank you.
Brilliant.